So before we get started, in this chapter 9, looking at the principles of exercise training, I want to introduce you to iCare, which stands for Implementation of a Cancer Rehabilitation Program. This is an internship that is run collaboratively with the Rehabilitation Hospital of the Pacific located on Kuakini Street. Through this internship, students will use the material that they learned in this class, KRS 354, and apply it in a clinical setting where they're paired with a cancer patient. They will be responsible for creating an exercise prescription tailored to the patient's medical history, fitness goals, and baseline fitness measures. So for example, in this program, we measure pre-exercise fitness outcomes such as VO2 peak, 1RMs, muscular endurance, flexibility, balance, and body composition, all components of fitness that you have learned and even measured in lab. So students are asked to use this information to design and deliver a 3-month exercise program to the cancer patient. To be eligible for this internship, the student must enroll in KRS 488. They must complete prerequisite classes with a B- or higher, including this course, structural kinesiology and weight training, maintain a cumulative GPA of 3.0 or higher, and receive a personal recommendation from our KRS undergraduate academic advisor, DA. The student must also complete background checks, immunizations, and drug testing in accordance with rehab policies. So this completion of this internship would fulfill KRS 488 requirements, including 160 hours of independent patient care. And this independent patient care is what sets this internship apart from many other internship opportunities. So in the bottom left-hand corner, this was a cohort of students that learned how to use a fitness cue, which they are holding in their hand, a piece of equipment that can be used to strengthen posture, flexibility, and muscular strength and endurance. In the middle picture, you will see our former student Mana performing a VO2 peak test on one of our cancer patients. And then the lower right-hand corner shows our first cohort of students. We're actually missing 2 students. We had 6 students in our first cohort who have completed the program and received a certificate of completion. This is our 3rd year running the program, and if you are interested in applying for this internship, please be sure to meet with DA, who will then refer you to me. In this section, we're going to cover the terminology for the exercise training principles. First is muscular strength, which is defined as the maximal force that a muscle or muscle group can generate. It's measured with the 1 repetition max. We measured 1 RMs in lab. Remember, we also used the Brozecki equation, which allowed us to determine the maximum amount of weight a person could lift for no more than 10 repetitions, and we could use the Brozecki equation to estimate the person's 1 RM. Muscular power is defined as the amount of force that can be generated over a specific distance over a specific time period. So time is that magic component to muscular power, where muscular power is the rate of doing work, but we're more concerned of the explosive strength, and it's a product of strength and the speed of the movement. Muscular endurance is defined as the ability to repeat sub-maximum contractions against a sub-maximal weight over time. So examples of this would be ninja warrior, pinning an opponent in wrestling, any activity which requires repeated muscular contraction over a long period of time. So this table is showing the difference between strength, power, and muscular endurance. So in the first row, it's showing the strength, and athlete B and C have the highest 1 RMs at 200 kilograms. The second row is showing power. So if we plug and chug into the equation for power, which is force times distance divided by time, we see that athlete A and C have the greatest amount of power. And the reason being is because they're able to move this weight in a short period compared to athlete B, who took 2 seconds to lift 200 kilograms. Muscular endurance is the ability to perform repeated muscular contractions over a period of time. So in this case, athlete B has the highest muscular endurance as he or she um, can perform 10 repetitions at 150 kilograms. So clearly, athlete B is an endurance type athlete, whereas athlete A and C are more power athletes. So keep this in mind when you start to design exercise programs. If you're trying to design an exercise program for a sport that requires power, you're going to prescribe exercises where the athlete moves weight in a short period of time to simulate that power. On the other hand, if you're training a long distance or cross country runner where power is not an important component for success in the sport, then you would be training the athlete for muscular endurance. Concurrent training refers to training for endurance and strength on the same day. Concurrent training is a great mode for individuals who are not competitive athletes. And the reason for this is because training both endurance and strength on the same day oppose specificity. Meaning, if you are trying to train a, an athlete for a cross country, you'd want them to train primarily in endurance. Vice versa, if you're training power lifters, you would not want to train strength and endurance on the same day because your primary purpose is to train their strength. Concurrent training is used in an unfit population in a sense that you're not worried that you're going to oppose specificity of training. If you were to use concurrent training, strength training should come first. So for example, strength training should happen in the morning, and then in the afternoon you can come back for endurance training. However, concurrent training does oppose specificity in the sense that if you train for strength in the morning and you ask your athlete to come at the end of the day to train for endurance, they're not going to give their 100% because they're going to be fatigued. So they won't be training specific to the sport of maximum power output or maximum exertion. So this is why concurrent training isn't often used. So in other words, highly fit individuals would not benefit as much from concurrent training. Unfit may benefit from concurrent training more because they have more room for improvement. However, I say unfit loosely because you would not want to use concurrent training in someone who has never exercised before because it would be too intense for them. So maybe concurrent training could be used when an athlete or client has hit some sort of plateau and you're trying to add variety into the exercise program. Highly fit individuals would benefit more from periodization, which we'll talk about in a different section. So when you're designing an exercise program, you need to keep the goals in mind. If you are training an athlete for a sport that requires endurance, you must train these specific metabolic pathways for endurance. And vice versa. If you are trying to train an athlete for strength, you need to train the pathways that are going to train strength. So you're going to increase the weight and decrease the amount of reps. For endurance, you'll increase the amount of reps and decrease the weight. You also need to think about how you're going to break up your weight training across the week. Are you going to have push-pull days? Are you going to break them up into upper body and lower body days? Or are you going to break up the days into agonist and antagonist? So you'll have a chest and tricep day, and then you'll have a back and bicep day. So there's a lot of thought processes that go into designing a training program. The other thing you want to remember is you always want to train big muscles to small muscles because you do not want to fatigue the small muscles. So by the time you get to that exercise, you're unable to perform that exercise. So for example, if I'm doing a back and bicep day, I will I would do biceps as my last exercise, bicep curls as my last exercise. I would do my lat pull downs. I would do my rows first because these incorporate bigger muscles. And then I would finish off with bicep curls because these are my smaller muscles. So the same thing goes for chest and triceps. If I'm doing a chest and tricep day, I would start off by doing the push-ups, the bench press first. These exercises that use both the chest and triceps. And then I would finish it off by maybe doing tricep pull downs or supine tricep overhead press. So you always want to train big muscles to small muscles. And then you also want to think about the client's needs. In today's world, the majority of your clientele, if you're going to go out and start your own business, would be an older generation, somebody who's looking for guidance as far as exercise and exercise prescription. So if they have trouble transitioning from machine to machine, you might want to do all 3 sets or all 2 sets, whatever it may be, on that same machine instead of supersetting. So supersetting means you would do your um, quadriceps leg extension, and then instead of sitting there and waiting around to let your muscles recover and rest, you would go ahead and start your hamstring curls. And then to let your hamstrings rest, you would jump back on to the leg extension machine. So if they have trouble getting on and off machines, you might want to not do supersets. If they have trouble getting down to the floor and getting up, you might want to do all floor exercises together. So these are different things to think about when designing an exercise program. The next section we're going to talk about, I will record in a different video. So this is the end of this section. In this section, we're going to discuss ways we measure aerobic and anaerobic power. In lab, we use the VO2 max test to measure aerobic capacity or power. We also used some maximal tests such as the YMCA submaximal bike test. Also, you all have or will do the field-based aerobic testing, where you could do the step test to determine or to predict VO2 max. There's also the 1 mile test, the 12-minute test that can be done to estimate somebody's VO2 max or aerobic capacity. Anaerobic power is defined as the rate of energy release that is derived from anaerobic metabolism. So for example, this would be measuring the power or capacity that we have to generate ATP from anaerobic glycolysis, the ATP PCR system. There is no universally accepted lab-based test, unlike VO2 max, which measures aerobic power. However, we have 4 different tests, such as the wind gate test, the vertical jump, the sprint test, and maximal accumulated oxygen deficit tests that we use. The wind gate test we do in lab, and then the maximum accumulated test I am going to describe on the next slide. So the Wingate test is a 30-second all-out test where we calculate 7.5% of the subject's body weight, and then we drop this weight at the beginning of the test. We ask the subject to cycle as fast and as hard as he or she can for 30 seconds. At the end of the test, we measure or calculate things such as peak power, the rate of fatigue, the mean power, and it's a test that requires the subject to give maximal exertion, which is difficult to do when it's a supermax test. AOD, or accumulated oxygen deficit, is the difference between the actual VO2 and theoretical VO2 during exercise. So essentially, it is a test that is used to quantify non-mitochondrial generated energy production during high intensity exercise. So this test is based upon three assumptions. The main one being that the energy release is equal to the total energy minus the aerobic release. It's also based upon the assumption that the oxygen demand increases linearly with the exercise intensity, and that the oxygen demand is constant from the onset of exercise with a constant exercise intensity. So AOD is a theoretical VO2 minus the actual VO2. So in a previous section, we talked about oxygen deficit. Oxygen deficit is the amount of oxygen that we don't use the beginning of aerobic activity. So remember, it takes about 3 minutes for the mitochondria to get fully running. And this is why we say endurance activity should have a warm-up of 3 to 5 minutes. So in this case, the oxygen deficit or debt would be the area above the pink curve. The pink line represents oxygen consumption measured with the metabolic cart. So the area under the curve represents the energy contribution which comes from aerobic metabolism. How do we know it's coming from aerobic metabolism? Because we're measuring oxygen consumption. In which case is oxygen used? Oxygen is used in aerobic metabolism. So the area under the curve represents the amount of energy contribution from aerobic metabolism. Therefore, the area above the curve must be energy derived from anaerobic metabolic systems. So how do we perform the AOD test? First, we have the subject performed 6 or 7 steady state exercises as shown here. And during each steady state exercise, we measure their VO2 and determine the VO2 or the oxygen consumption at each workload. So for example, at 50 watts, the subject consumed 14 mLs per kg per minute. At 75 watts, the subject consumed 21 mLs per kg per minute, and so forth. Then we also had to do a VO2 max test on this subject. It's actually a VO2 peak test because we did not see a plateau in VO2. So VO2 is on the y-axis and time is on the x. So we did a VO2 max test on a cycloergometer. And the subject's VO2 peak was 52 mLs per kg per minute. We wanted to set a super maximal intensity, so we multiplied his VO2 peak by 130 or 1.3. And then this is how we got this number of 68.5 mLs per kg per minute. So we set this workload based upon his VO2 at a supermax workload. So what we did with the steady state workloads was plot them against the power output. So for example, at 50 watts, the subject had a VO2 of 14 mLs per kg per minute. At 200 watts, the subject had a VO2 of 35 mLs per kg per minute. And we did this for each of the stages. And then we drew a line and then extrapolated out until this line hit the VO2 that we set as a supermax workload. Then we dropped a vertical line down to determine at what workload would we have to set that this subject would have a theoretical VO2 of 68.5 mLs per kg per minute. And we determined this workload would be 404 watts. So the super maximal workload for the subject for the AOD test was set at 404 watts. So like the Wingate test, we gave the subject a warm-up and then we dropped the weight, which was 404 watts. We had the subject cycle for as long as he could until volitional fatigue, and he could only sustain this for less than 2 minutes, so a minute and 3/4. We measured his oxygen consumption during this time, and the area under the curve represents the amount of energy that was derived from aerobic metabolism. Since we knew that the theoretical VO2 should be 68.5 mLs per kg per minute, we could then assume that everything not under the curve, so everything over the curve or above the curve, represented AOD, or accumulated oxygen deficit. So if it's not aerobic metabolism, it's anaerobic metabolism. We know aerobic metabolism is going to be derived. We know that aerobic metabolism can be measured with oxygen consumption with the metabolic cart, and anything above the curve would be AOD. So the bigger the AOD, the greater the anaerobic capacity of the person, of the subject. So for example, a study tested the VO2 max and AOD of resistance trained and endurance trained athletes. In resistance trained athletes, the VO2 max was lower than endurance trained athletes. That's not surprising. But their AOD was much higher versus their VO2 max. And that is expected because as resistance trained athletes go, they should be training for strength, which means they're not going to be training for endurance. Remember, it's the oxygen carrying capacity, it's the capillarization, it's the increased mitochondrial density, which is going to support the endurance athlete. But in resistance trained athletes, they're not training for endurance, they're training for strength. And this is why it makes sense that their mean AOD would be higher than their VO2 max, because the AOD is a measure of anaerobic capacity. So it makes sense that the resistance trained athlete has a higher anaerobic capacity versus aerobic capacity. And then vice versa. In endurance trained athletes, it makes sense that their VO2 max is going to be higher than their AOD. So in essence, the AOD is determined by calculating the difference between the actual VO2 and the theoretical VO2. So the actual VO2 is this pink line, what we actually measured, and the theoretical VO2 is what we calculated out. So if the energy contribution is not coming from aerobic metabolism, it must be coming from anaerobic metabolism. And by measuring this oxygen deficit, we can estimate a person's anaerobic capacity. So if this subject was a resistance trained athlete, we would expect this curve, this pink curve, to fall below, where the VO2 would be lower and the AOD would be higher. If this athlete or subject was highly endurance trained, we would expect the pink line to be higher, which would represent a much higher VO2 compared to AOD, which is a measure of anaerobic capacity. So that is AOD in a nutshell, and this is the end of this section. In this section, we're going to cover the principles of exercise training. The first principle is the principle of individuality, which states that except for identical twins, no two people have the same genetic characteristics, and therefore variations in cell growth, metabolism, cardiovascular and respiratory regulation, neural and endocrine regulation lead to tremendous individual variation. And this accounts for why some people are high responders to an exercise program versus others who are low responders. An example of this would be a husband and wife couple coming to you for exercise training. Typically, the husband is going to see faster muscular gains and faster weight loss compared to the wife because of the higher levels of testosterone in the male. So this is one example of principle of individuality. Also remember, we get all of our mitochondria from our maternal side. So it'll depend on our genetic makeup that was given to us by our parents that will determine our responsiveness to an exercise training program. The second principle is the principle of specificity. So just as the name applies, this principle says that the mode of exercise, the metabolic system, and the speed of muscular contraction needs to be trained in a way that's going to be specific to the sport or the goal. So for example, if you're training an athlete to be a cross-country runner, you would be training the muscular endurance pathways. If you were training a high jumper, you would not have this high jumper go out for 2-mile runs because you're training the wrong system. You need to be training the strength system, the ATP PCR system, the explosive system. So this principle is specific to the mode of exercise, the metabolic system, the speed of contraction, and even to conditions of performance. If you are going to be performing on a field in front of a big crowd with a lot of noise, this needs to be replicated during training. The principle of reversibility says that detraining will reverse the physiological adaptations that were gained during training. And this is where the mentality of use it or lose it comes into play. However, remember we learned that we still retain the same number of nuclei during detraining, which allows our muscles to recover from detraining or immobilization faster than it took our muscles to develop the first time around. Also, the satellite cells help in this process. Remember, the satellite cells reside between the basement membrane and plasmalemma in the sarcolemma or the cell membrane of the skeletal muscle cell. These satellite cells are normally quiescent, meaning quiet, they're not active, they hang out on the side until they are called into action. And in times of injury or muscle rebuilding, they act as a reserve of population of cells that are going to be able to proliferate in response to injury or give rise to regeneration of muscle and to help build additional satellite muscle cells. So although the principle of reversibility says if we use it, if we don't use it, we're going to lose it, our satellite cells are going to help us to get these gains faster after injury or detraining. The principle of progressive overload, as the name implies, means that we have to apply progressive overload to the systems, whether it be the muscular systems, the cardiovascular system, the metabolic system, to see gains. So in order to generate muscle gains, there must be progressive overload. This means that if an athlete rates a weight training activity of 5 out of 10 on an RPE scale of 1 to 10, then muscle gains will probably not occur because 5 is right down the middle. It's not that difficult. If you're looking for muscular gains, the athlete should be rating the activity an 8 to 10 on a scale of 1 to 10, meaning this principle of progressive overload is being applied where they are progressively overloading the muscle and therefore the muscle will have to come back stronger. There are activities where RPE should be a 5 out of 10, and this would be, some examples of this would be working on tactics in a field-based sport, maybe it's hockey or lacrosse. There are activities where the RPE should be lower, and this is when skill-based activities or where the focus on the mental or cognitive aspect is the goal and not muscular gains. So if you're looking for muscular gains in that activity, we need to see that the athlete or subject is working at a very high intensity. The progressive overload also applies to the metabolic system and cardiovascular system as well. So if you are training an endurance athlete for a run and they come back in and they say, oh, that was a 5 out of 10, they are not working hard enough. They're not pushing the intensity hard enough to see the gains that would help them improve their performance. The principle of variation, aka the principle of periodization, talks about how to incorporate different aspects of the sport into a training regimen. So this is the principle I was referring to when I said that highly fit people would benefit from periodization more than concurrent training. Recall that concurrent training is when you train both endurance and strength on the same time, on the same day, and that strength training should always precede endurance training. So if you're working with a highly fit population, using variation or periodization would be a better alternative. So classical periodization involves initial high training volume with low training, and then a decrease in volume with gradual increases in intensity. In other words, whenever there's going to be a bout of high intensity, volume is going to be reduced, and vice versa. When volume is high, intensity is low. And this reduces the risk of overtraining syndrome. There's sports that specifically train using macro cycles, which are scheduled around major competitions. And these are usually your field-based sports where they need to focus on, within each mesocycle, where they need to focus on muscular gains, cardiovascular endurance, tactics, skills. So for example, in soccer, a macrocycle is going to be composed of 2 or more mesocycles that are going to be built around the date of competition or date of the tournament. And each mesocycle is going to be divided into different times where the team will focus on a specific aspect of the sport. So for in soccer, maybe the first aspect that they will focus on would be endurance, because they're coming off an off season. So they need to build up that cardiovascular endurance and build back up their metabolic system. Then after that, maybe they'll switch off to strength training to build those muscular gains, but they wouldn't concurrently be training strength and endurance at the same time because that opposes specificity. And then in another time period, they might focus on tactics and plays and skill-based drills. And this is how the principle of periodization is used in sport and activity. So the principle of variation talks about overlapping or organizing different aspects of performance into a calendar to best support your athletes in their performance. So the macro cycle is the largest component of the largest component or the biggest time period, and the macro cycle is broken down into mesocycles. So this is an example for soccer. We're coming off an off season. We would focus on endurance with our athletes to build up their mitochondrial, their capillarization, build their cardiovascular system. At the same time, we could also work on technical skills because this is not very energy depleting, the technical skills. It's not going to cause overtraining. And then over the second mesocycle, we would reduce the endurance training and then slowly beef up the tactics and then the strength and speed. And this will allow us to not oppose specificity, but be able to train all components that are required in this sport, which in this example is soccer. The principle of diminishing returns says that there's a biological or genetic ceiling that everyone has. So this means that an elite athlete, their performance is already almost hitting that genetic ceiling. So they would need to work very, very hard for very, very small gains in physical performance. On the other hand, somebody who is unfit or moderately trained is going to have bigger gains. They're going to be able to accomplish bigger gains, which means they're not going to have to work as hard to achieve these bigger gains. And then, for example, in low fit individuals, they wouldn't have to work as hard to see immediate gains because they are very far from the genetic ceiling. So if you're working with an untrained subject, this principle of diminishing returns says that their RPE could be as low as 1 to 3 on a scale of 1 to 10, and they will still see muscular gains, and they would see cardiovascular gains, and they will feel different. Part of these adaptations, if you recall, are due to the neuromotor related adaptations. The neuromotor adaptations such as increased rate coding, synchronicity of motor unit recruiting, which will increase force. So if we increase the amount of motor units that are activated at the same time, the outcome would be an increased muscle force production. Knowing which muscles to contract and which muscles to relax is another adaptation or another neuromotor adaptation. Remember that rate coding is the rate at which an action potential is sent. So the faster the rate coding, we are able to increase the amount of force a muscle can produce. So this is the end of this section, and we will talk about this section in another video. In this section, we will examine different types of strength training methods. So the first slide I would like to talk about is the one with this table on it. This table comes from your textbook, and it lists the ACSM recommendations for resistance training programs, and it outlines different goals of resistance training programs. So for example, strength development, muscle hypertrophy, muscular power, and muscular endurance. You'll notice that the principle of progressive overload was built into this table, where the novice individuals have a lower resistance or workload compared to the advanced lifters. And this is true for all of the categories in the table. In the advanced strength development, it says unintentionally slow to fast, which in my mind, it makes sense that in advanced lifters, we would intentionally ask them to lift at a slow or fast muscular contraction. If we ask them to perform a fast muscular contraction, this makes sure that we will be training muscular power, as seen in this section below. In the power section, you notice that the number of reps are limited to 6. And this makes sense because when we're lifting for power, we want to lift a weight as fast as possible. And if we were to prescribe more resistance, the speed at which that weight would move would slow down. And in that case, we would not be training muscular power. In muscular hypertrophy, you'll notice in the advanced athlete or subject, the number of reps is as low as 1 rep, indicating that that 1 rep is going to be as close to that person's 1 RM. When applying this table, you want to make sure that at the end of whatever the prescribed set and reps are, that the corresponding RPE meets a certain threshold. So for example, a novice or intermediate, so for example, a novice, the RPE of maybe 1 to 3 or maybe 1 to 5 would be appropriate. In intermediate lifters, an RPE of 3 to 6 would be appropriate. And then in advanced lifters, an RPE of anywhere from 5 to 10 on a scale of 1 to 10 would be appropriate. When we're training muscular endurance, you want to be careful in weight training, because if you increase the number of reps and have them perform 3 sets, this could lead to overuse injuries. So in essence, I suggest that weight training be used to strengthen muscular strength, to work on muscular strength. If your goal is muscular endurance, I would combine strength training using this chart up here in this first row with an endurance sport or endurance activity such as running, walking, swimming for upper body, rowing for upper body muscular endurance. Just because the given rule or the suggested rule is if your athlete or client is able to lift that weight for more than 10 repetitions, it's time to increase the weight. So I would be careful in prescribing any exercise that has 15 or more repetitions. Okay, so now we're going to go over the different types of resistance training. The first one is isometric training. Isometric training are our holds, right? When we are contracting our skeletal muscle, but the skeletal muscle is not having a change in length. These isometric holds are really great for novices and for advanced athletes. So in novices, these holds would be great, for example, somebody with impaired balance who has a goal of being able to squat or maybe stand up from a chair. Having them do an isometric squat hold against the wall takes balance out of the equation. So now they can just focus on gaining muscular strength in their legs. When performing isometric training, you want to be careful of the Valsalva maneuver. If you are working with a client and say, for example, they're doing this plank here and you see their heart rate start to spike, it's probably because they are breath holding. Remember, the Valsalva increases the intrathoracic pressure, which then would decrease the venous return to the heart, which would then decrease stroke volume. And remember, in the previous section, we talked about how it's important to maintain cardiac output. Since Q is equal to heart rate times stroke volume, a decrease in stroke volume would mean that heart rate would need to increase. So if a patient or a client is holding their breath, most likely you will see a spike in heart rate. Kegels are also great to incorporate into any regimen. These are especially important for individuals with incontinence issues, for individuals who've undergone abdominal surgery, for older populations. The general rule of thumb is that Kegels should always be cued in any exercise that requires posture or isometric holds. So for example, if you ask somebody to do a bent over row, the first thing you would do is get their feet set up, and then you would ask them to cue or to Kegel up to contract their pelvic floor muscles. And then I would hand them the weight and make sure their posture is good before I ask them to do the actual exercise. Free weights versus machines. So free weights are good for training individuals who have exercise trained before. If you've ever done a bicep curl, you've noticed that at 60 degrees is the point at which the weight feels the heaviest. So therefore, this is the point where people start to use their momentum to get that weight all the way up to complete that entire range of motion. So in this case, free weights would be not as advantageous versus machines because in free weights, people can quote unquote cheat or use their momentum a little bit easier than if using the machine. So free weights are usually the best choice for new exercise. Machine weights are usually the best choice for new exercisers because they only have to push or pull against the machine in a single plane. Versus if they are a new exerciser and you would like to build them up to, say, doing a dumbbell chest press, A good option is to either use TheraBands first to allow them to determine which angle of muscular contraction that they will be pushing in, and also maybe use of very light dumbbells. If you're using free weights with your client, you want to ensure that they don't have any underlying conditions which would limit their grip strength. So for example, in our cancer patients who have undergone chemotherapy, especially the taxane, leads to symptoms of CIP and chemotherapy-induced peripheral neuropathy. What this means is that they either have pain or numbness in their hands and the soles of their feet. So holding things in their hands, their grip strength is going to be lower. In these cases, machine weights or TheraBands would be preferable to free weights. Free weights is good because we can train the muscles in different angles or planes. We can also add variety to exercises by adding balance with muscular strength. And these are more advanced exercises. The other question becomes, does the exerciser fit the machine? Here in Hawaii, we have a lot of smaller adults who may not fit the exercise machine. In this case, free weights may be better for training these individuals if the use of towels to help prop them up, or towels, for example, in the hamstring curl. I've had to put a towel across the lap of different individuals whose thighs were too small to fit the machine. So by putting a towel on top of their lap, allowed them to use the hamstring curl machine easily. So these are just some considerations to take into account when designing an exercise program. Okay, so that's the free weight versus machine controversy. Eccentric training emphasizes the eccentric phase when the muscle is contracting, but the muscle is lengthening. This is AKA our negatives. These are great for developing hypertrophy. Remember that DOMS, delayed onset of muscle soreness, results after eccentric training, and eccentric training is the most potent form of training to stimulate hypertrophy. So eccentric training is a beneficial way to strength train. In addition, eccentric training is going to be good for helping your athlete or client to progress to the full movement. For example, push-ups or pull-ups. Many people are unable to complete a push-up or a pull-up. In this case, you would ask them just to perform the negative aspect of the exercise. So for example, in the push-up, you would ask them to get up into the plank and slowly lower themselves to the floor, and then ask them to get back up into the plank in any way they can, and then slowly lower themselves to the floor. In this example, they are resisting gravity, and they're concentrating on the eccentric component. Since the eccentric component or eccentric contraction can generate more force in the concentric contraction, this is going to be an effective way to help people build up their muscle to complete the full movement of the exercise. Variable resistance training utilizes a rotating cam in the machine so that resistance is decreased at the weakest point in the range of motion, so that the extra momentum or quote unquote cheating does not have to happen to complete that full range of motion. Isokinetic training keeps the speed of contraction constant, or it caps that speed of contraction. Isokinetic training is not sport specific, and it's usually used in a clinical setting in rehab or in physical therapy, where it's intended to measure or evaluate the strength of muscles and the range of motion of joints. So since it limits the speed of contraction, this reduces the risk of injury in the client or athlete. Plyometrics is the stretch shortening cycle exercise, and it became popular in the 1970s and early 80s, and it was known for improving jumping ability. And plyometrics is when we first essentially contract the muscle and then concentrically contract it, such as box jumps, such as push-ups with that clap, such as jump squats. So plyometrics is a very effective form of strength training. There are three mechanisms or rationales which are still unclear on why it's so effective. The bottom line is that plyometrics is very effective in increasing jump performance and increasing power. One underlying rationale is that greater elastic energy recoil is stored in the muscle after the eccentric loading. Essentially, that potential energy is being utilized. The potential energy that's stored after the eccentric loading is stored and then used during that concentric phase, which increases force production. The other rationale is that it forces the athlete to get into that crouched position prior to the concentric contraction, and this allows the athlete or subject to apply more power or torque. So it's a biomechanical rationale. And the third rationale that we learned about previously was the rationale involving the muscle spindles, where the muscle spindles send sensory information to the CNS about the lengthening of the muscle. The CNS understands or knows that a concentric contraction needs to happen. So when the sensory information from the muscle says that this muscle is lengthening, the CNS sends an efferent message to the muscle, which helps to increase force production. So that third rationale is due to the muscle spindle action. One of the biggest risks of plyometrics is injury, just because many of them stress the eccentric component a lot. And this, we know the eccentric component is a major cause or is the cause of delayed onset of muscle soreness. E-stim or electrical stimulation does not work in healthy adults or athletes. We've seen these on the late night infomercials, but they do not work. They do work in a clinical setting where the goal is to reduce the loss of strength and muscle size during periods of immobilization, but there's no evidence that we are able to enhance our muscular strength in healthy subjects. Core training is really important because strengthening our core will improve our posture. As we improve our posture, our balance improves. Also, with increased core strength, our distal movements, the movements that are distal from our core or our center of gravity, are going to be strengthened as well. So having the core stabilized and engaged when throwing a ball allows for greater biomechanical efficiency. There are many different ways to train the core being comprised of the abs, the obliques, and the back muscles. Pilates is a great way to strengthen the core muscles because it allows for incremental resistance in strengthening the core. Whereas if you were to do a core strengthening regimen, not on the reformer as shown here, you would only have one resistance, which would be your body weight. So if you've never taken a Pilates class, I would suggest you purchase a Pilates class the next time that Groupon comes around and participate in Pilates to see how this type of exercise focuses on your core, on your posture and balance. Speed and agility are also important factors in strength. So using ladders or cones or change of direction will help to develop speed and agility of your athletes. And remember, all of these distal activities, such as change of direction, relies on core strength, because core strength is going to increase the movement and stability of more distal movements. And this is the end of this section. In this section, we're going to look at anaerobic and aerobic training systems. In the metabolic system, we know that we can't separate an activity into purely being 100% aerobic or 100% anaerobic. And although I presented the material in this fashion early on, I put a disclaimer out there saying that although this activity is classified as aerobic, it still relies on a little bit of anaerobic metabolism. For example, within the first minute of endurance activity, we accrue oxygen deficit because we rely on anaerobic metabolic pathways to supply energy in the beginning part of this endurance event. Likewise, a lot of the sport athletes, basketball, soccer, lacrosse, combine anaerobic and aerobic components. For example, they need to be able to sprint at high intensity using their anaerobic system. And then they also have to last the entire game, which is their endurance, and this is the aerobic system. So we're going to look at different ways to train these systems in this section. And the first one is interval training. Interval training is when you ask somebody to do a period of high intensity and then intersperse it with bouts of low intensity. This is really great to help people get back into shape or come off the off season. So if you have a client who has a goal of running 20 minutes or jogging 20 minutes consistently, but he or she's unable to do so, you could employ interval training where you would ask them after a warm up to jog or run for 1 minute and then walk for 2. Jog or run for another minute and walk for 2. And do this for the entire 20-minute interval. And this is interspersing bouts of anaerobic or energy derived from anaerobic metabolism interspersed with bouts that are going to be supplied with the aerobic system, or the energy is going to be derived from the aerobic system. Eventually, you will shorten these low intensity and increase the duration of the high intensity, and maybe even take out some intervals so that he or she would have less intervals and slowly build up to a consistent 20-minute run or jog. So when you are setting up the intervals, you want to determine either are you going to use distance? Are you going to have the person run outside and run from sidewalk to sidewalk, not sidewalk, from intersection to intersection? So are they going to jog one block until they hit the next intersection and then walk until they hit the next intersection? So there's different ways that interval training can be adapted in and outside of the gym. On the track, you may have heard of ladders, which is a popular training tool for track and field and sprinters, where you would ask the athlete to sprint 100 meters, which is the straightaway, and then the next interval would be a 200-meter sprint followed by a 30-second slow jog, and the next one would be a 400-meter sprint, which is one lap around the track followed by a 30-second slow jog, and then a 2-lap 800-meter run followed by a 30-second slow jog, and then the athlete would repeat the sequence back, running at 800 followed by a 30-second break, a 400, a 30-second break, a 200, a 30-second break, and then a 100-meter run. And this is another example of interval training, and in this case, this is called a ladder. If you don't want to use progressive increases in distance, you could set the same distance, but ask the athlete to perform the set distance for a set number of reps. So in this case, it's 6 times at 800-meter run, and then giving them a longer rest period or a longer low intensity bout, just because this is going to be pretty intense. 800 meters is half a mile. So you're asking them to run half a mile 6 times at a high intensity. So obviously, the longer or the more intense the distance, the longer the low intensity work bout should be. And as they become fitter, this rest period should progressively become shorter and shorter. Other ways to determine interval intensity is to determine a target heart rate. So you could ask the person for their age, determine their age predicted max heart rate, and use the Carbonin equation, which we'll cover in a little bit, to determine their target heart rate. Another way to set intensity is by asking them to complete a run of fixed distance in under a certain time. So in this instance, it's to run a 400-meter run in 75 seconds or less. To train the ATP PCR system, the athlete would have to work at 90 to 98% of their personal best time, meaning they would have to train at or near maximum exertion. And to train the anaerobic glycolytic system, the intensity will be a little bit lower. And then to train the aerobic system, the intensity will be a little bit lower, but the duration of the activity will be longer. So there's going to be a give and take, an inverse relationship between duration and intensity. So with the ATP PCR system, it's going to have the shortest duration but the highest intensity. And then to train the aerobic system, you're going to have a longer duration with a lower intensity. But notice that this lower intensity is 75 to 85% of the personal best time, indicating that this person should still be working at a 7 to 9 on an RPE scale of 1 to 10. So heart rate can be used to ensure that the subject or the athlete is working within the proper target heart rate zone. If the heart rate monitor is not available to you, the RPE scale is valuable as well, as it will be able to determine the intensity that your athlete is performing at. However, the RPE scale is a little bit tricky because it's a subjective scale. So you would have to believe the RPE that is being reported to you. If the RPEs that are being reported to you don't make sense, then it might be useful to use heart rate monitors to determine intensity. So this is the Carbonin method of determining target heart rate. The Carbonin method uses heart rate reserve. Heart rate reserve is the reserve or the difference between the maximal heart rate and the subject's resting heart rate. The reason why when we determine target heart rate, the reason why we do not just multiply your target heart rate or your maximal heart rate times the intensity is because we want to take into account the person's resting heart rate. So by taking into account the person's resting heart rate, we will ensure that the person is working at the correct target heart rate. So for example, if a person has a high resting heart rate and you multiply, say 70% times their maximal age predicted heart rate, this would underestimate their target heart rate. Likewise, or compared to somebody with a low resting heart rate, if you were to multiply their maximal heart rate, age predicted heart rate, by 70%, this would be a relatively more difficult intensity for this individual. So in essence, what we do is multiply the intensity of the activity times the heart rate reserve, where heart rate reserve is the person's maximal heart rate subtracted out their resting heart rate. This heart rate reserve is what is going to be multiplied by the intensity. And then we have to remember to add back on our resting heart rate. So this method accounts for the subject's or athlete's resting heart rate. We're not going to go over blood lactate. It's not a practical field-based measure. Another way to determine exercise intensity or intervals for the intervals is by use of distances. So if you're training for a field-based sport such as basketball or soccer, you want to use intervals or lengths of the court that are shorter or smaller than the actual field or court. In this case, you could ask the subject or the athlete to run the certain length under a certain time period, and this would set the intensity. So just to reiterate, if you're working for endurance, you'd want to increase the number of reps and decrease the weight. If you're working for strength, you want to increase the weight and decrease the number of reps. By shortening the rest interval between work bouts, this will increase the intensity of the exercise plan. So this is an example of applying the principle of progressive overload in training the endurance aspect. So by decreasing the rest interval in different work bouts in, say, the interval training program, you are using the principle of progressive overload to ensure that the athlete will continue to gain adaptations in the cardiovascular system and in the endurance metabolic system. This is just a reminder that if you're weightlifting, the rapid phase of creatine phosphate recovery is going to be 80% complete in 5 minutes, and then the slow phase of creatine phosphate recovery will be complete in 10 minutes. So it doesn't make sense to sit around for 10 minutes between exercises, and this is why supersetting or doing interval training where you would work different muscle groups in a certain order is often used in training. Frequency will also have to be determined. So if you're not working with an athletic sport, but you are a personal trainer, you will have to decide the frequency that you meet your client. So typically, the ACSM guidelines say that we should complete 150 minutes of moderate to vigorous activity each week. So depending on how many minutes you spend per each session will determine how many times you would meet your client. Typically, it's done 3 times a week just because incorporating longer training programs twice a week could be too demanding, especially on new exercisers. So continuous training, or the long, slow distance, became really popular in the 1960s. And people believe that if you go as long as you can, but it doesn't matter the intensity, this had the same effect as exercising. This had the same effect as exercising at your maximum effort. This is not true because remember, the principle of progressive overload states that you must stress the system in order to gain adaptations. So if you're not stressing the system enough, your body is not going to come back and adapt to that training load. So this continuous training is effective when you're training at least 70 to 80% of your max. Fartlek training was developed in the 30s and it's Swedish for speed play. Essentially, what this is that the subject or athlete will self-select the speed that they run at. And it's supposed to be a fun way to perform continuous training. So it's similar to going out for a long distance run, but instead of having a steady state pace for the entire run, the athlete would self-select a faster pace interspersed with a slower pace. And it was supposed to be a free-form training in which the primary goal was to have fun. So this is the same slide or the same concept as a long, slow distance as 2 slides ago. So I'm not going to spend much time on this slide. So here's the interval circuit training. I really like integrating circuit training in a gym setting. So say you are coaching a volleyball team or a basketball team, and you need to incorporate some sort of aerobic and anaerobic training. So you would set different activities up around the room, around the gym. In this case, it's soccer around a field. And you would ask them to do sport-specific things or sport-specific activities. So for this example, in soccer, they're doing sit-ups with the ball for a set amount of time, maybe it's 60 seconds, and then they have 5 seconds to go and perform the next activity, which in this case is a wall volley throw and catch for 60 seconds. And then they have 5 seconds to make it to the next activity, which is pretty funny because it says a 2-hand between the legs toss and catch, which I've never seen before, but that definitely adds a component of fun into this circuit training. And then they'll do that for 60 seconds. And then say they'll have 5 seconds to get to the next station, which is a side-to-side shuffle. And then the next station would be push-ups in the ball, where you're focusing on anaerobic strength and also endurance because you're going to have to do push-ups for a minute. And so on and so forth. So they will do sport-specific skills in a sequence. So at each station, it's like intervals, where in each station they're doing an anaerobic activity, but you're going to have them do this for maybe 20 minutes total, depending on how many stations you have set up. So that 20-minute timeline indicates that this is also endurance training, but you're also doing skill-based training in this circuit training as well. So it makes it very sport specific and a really great way to train your athletes and even clients, because I've done this as well in a group exercise fitness class where I'd have one station maybe with the cycle or the spin bike, another station where they would be doing some sort of core exercise, another station with a jump rope, another station where they would be doing a plyometric type exercise. And this type of training makes the time go by very, very quickly. So it's a great way to train both athletes and clients who come to you for personal training because it's very fun and entertaining. High intensity interval training, also known as Tabata training, is a really effective way to train all systems together. So I realize I am going back on what I'm saying as far as the training principle of specificity, where if we're training for strength, we can't be possibly training for endurance. Here I'm walking back on that statement a little bit because in Tabata training, we are incorporating, like interval training, we're incorporating high bouts of anaerobic activity, but we're doing it for 20 or 30 minutes, which makes it an endurance-like activity. So examples of a high intensity interval training would be to set your interval timer to a 30-second work bout to a 10-second rest. So you'll set your timer for 30 seconds. The next timer should be a 10-second timer. And then this should be repeated for the number of exercises you have planned. So for example, we might have 30 seconds of all out cycling, and then 10 seconds of rest, and then another 30 seconds of all out cycling, and then 10 seconds of rest. If you're not using exercise equipment, you could do body weight exercises, and you would do 30 seconds of jump lunges, have 10 seconds of rest, and then move to the next exercise. So you're going to do burpees for 30 seconds. And then when the timer beeps, you'll have rest for 10 seconds, and then 30 seconds more of squats, jump squats, whatever it may be, weighted squats with dumbbells, and then 10 seconds of rest, and then mountain climbers for 30 seconds and 10 seconds of rest. One thing to remember here is the longer this duration, it's going to cause psychological evaluation of what the person is doing. So for example, if I say you're going to do 20 seconds of this activity, you're more likely to go all out for that 20 seconds. On the other hand, if I say you're going to do this for 1 minute, in your mind, you're already pacing. How am I going to do jump lunges for 60 seconds to make sure that I can complete the entire work bout? So be careful when you set these different work bouts, because the longer the work bout, you're already going to be shifting the activities to more of an endurance approach. But if you're working for power, you definitely want to reduce this work bout to 20 or 30 seconds at most, so that the subject or the athlete performs these exercises at the fastest contraction and the fastest time possible. So high intensity interval training is very effective. When well-trained cyclists replaced 15% of their normal training time with high interval training, they improved their peak power and speed during a 4-kilometer time trial. And this was seen only after 6 high intensity exercise sessions. So it's very effective in training anaerobic and power. And when compared to traditional continuous endurance training, high intensity interval training has shown similar improvements in VO2 max. So high intensity interval training is very effective, a very effective method of training. So if you have a client who comes to you and says, I only have 30 minutes, is it possible for me to see fitness gains? The answer will be yes, because you could employ high intensity interval training. Keep in mind, high intensity interval training should be reserved for those exercisers who have exercise experience. It's not going to be great for novice or new exercisers. So once your subject or your athlete has hit a level of fitness that you or they are satisfied with, it should be maintained. And this maintenance is going to be able to be accomplished by a 1/3 reduction in load. So say for instance your client was coming to you 3 times a week and they've hit their fitness goals. They're going to be able to now reduce their frequency and come to see you twice a week instead of 3 times a week. And this will allow them to maintain their fitness goals as it stands. So when we say maintenance, we say maintenance implies you do not have to work or push as hard because you're not seeking fitness gains. However, you are trying to maintain the fitness that you have already gained, which can be a little bit tricky as well because motivation comes into play. So making sure that your client remains motivated to come and see you, which means you have to add variety into your exercise regimen, and that's where cross training comes into play. Okay, so what is really exciting about this section is now, up to this point in this class, we have covered everything you have to know to now start creating exercise programs for people that come to you in different scenarios or settings. So for example, a client comes to you with a goal of hiking Machu Picchu, and she is 60 years old and has beet cancer. She's in remission, and she is not currently on beta blockers. Beta blockers prevent heart rate from increasing with increasing intensity. So this means that we can use target heart rates to set her intensity. If she were on beta blockers, we would not be able to use heart rate to set her intensity, and we would have to rely on RPE or a timed distance model. She has exercised when she was younger, but hasn't gotten back into shape since her cancer diagnosis. So, what are some of the things that come to mind when developing an exercise program? On the right hand side, I listed questions that should jog your thinking. So for example, what are the metabolic systems you will train? Obviously, the endurance, the aerobic system. Will you train for muscular power, strength, or endurance? In her case, Machu Picchu, the hike is not going to be something reliant on power. So I would be focusing on endurance and strength because that is all uphill. Plus, she's going to have to carry her backpack for her hike. Are there other specific areas that you would train for? Definitely. It's not a paved road, so I want to make sure that she has enough balance, that she has the leg strength to navigate the uneven terrain. Will you calculate her target heart rate? And the answer would be yes. I'd probably ensure that she's working at her target heart rate and also use RPE to ensure that she's working at a high enough intensity to see the gains. How will you structure your training regimen? I would probably start her off with an endurance type activity and then get her in the gym to do strength training, either with machines or free weights. And then I would slowly incorporate balance training. And then I would apply the principle of specificity, where then I would ask her to walk either on a treadmill or do stair climbing with a backpack on, just to make sure she's ready for her hike. And then even more, I would ensure that the conditions that we train in would be similar to the environmental conditions that she would be exposed to during the real thing. So I'm going to assume she has 3 months to train, and I would not find it absolutely necessary to measure her progress because she will be able to she would be able to verbalize her progress, and as long as she would be able to complete that duration, so we would look up how long it takes somebody to complete this hike. If she would be able to complete the duration of exercise with the exact weight of the backpack that she's expected to carry, then we would feel pretty confident that she could complete this goal. So in this case, we might opt for some maximum VO2 peak test just to suffice our curiosity, but it's not absolutely necessary. Okay, so scenario 2, you're assigned to train a basketball team that consists of 15 boys. They are seniors in high school. They have not played together yet. Yikes. They are a new team, and their goals are to learn skills, tactics, and to win at least 30% of their games. So hopefully they've played basketball separately at some point in time. So as a coach, what would you start off with? What types of activities? Hopefully you're thinking, okay, first we're going to hit endurance because we want to boost self-confidence in this team and they could all run. So we're going to hit them with endurance first with maybe team runs around the track. And then we're going to incorporate interval training in a gym where they will partner at each station, which will be which will be team building. And at the same time, they will work on their endurance, their aerobic capacity, their anaerobic capacity, and skill-based activities as well. We'll probably use periodization, just like we talked about in the soccer, where in the first mesocycle, we would focus on endurance and tactics. And then on the second mesocycle, we'd focus on speed and weight training. And then the third mesocycle, bring them back together for gameplay. So we would run drills where they'd be running the entire practice, which will stress their cardiovascular system, strengthen their endurance, and within these drills, they're expected to change their speed. So they would also be training their anaerobic system. And then we'll also break it down to work on different game-specific scenarios, such as free throws. So in this scenario, I would have built in 3 mesocycles. The first mesocycle being endurance, the second mesocycle being weight training, and then the third mesocycle being gameplay. That there's multiple ways to build this into. There's multiple answers here. So these are just ideas, and it's not necessary to determine their fitness. It's not going to help them win any games. It's not testing their pre and post fitness is not going to be essential for their success in this season. So I would not test their fitness. In scenario 3, the client comes to you with a goal of getting off metformin. She's 50 years old, so she's relatively young, and her resting heart rate is 68 beats per minute. She is not on beta blockers, which means we can use target heart rate as a measure of intensity. And she would like to join a paddling club, but she hasn't paddled since high school. So it's great that she has a specific sport, a goal for a specific sport in mind, because it's going to help you determine or keep her vested in this exercise regimen. So what would you do? What would be the first thing you do? Would you do fitness testing? That is not entirely necessary. We could if we were just very curious and she wanted to see pre and post improvements. But the first thing I would do would be focus on using her large muscle groups for exercise because they are the biggest consumers of glucose, which would help her regulate her blood sugar. So metformin is a drug that helps type 2 diabetics regulate their blood sugar. So that was my clue that we need to use large muscle groups so that her cells become more insulin sensitive and she can increase the number of GLUT4 proteins within the cells. And this is going to help her regulate her blood glucose levels. I would also incorporate strength training. So when she's not exercising, her resting metabolic rate will be elevated, which will help her burn more calories throughout the day when she's not exercising, which would also be beneficial for improving her type 2 diabetes. I would also get her in the gym. So after she's comfortable and um, she feels like she's able to complete whatever I've prescribed, I would then incorporate strength training, especially of the upper body, starting her off on machines first, and then incorporating free weights. And then use free weights to train her core and to train her balance. And then when she's ready, I would ask her to research paddling clubs, and I would wait to ask her to do this until she's built enough self-esteem and self-efficacy where she's reached a level where she believes she would be successful. So that's another layer of progressive overload, is the psychology aspect, where you want to make sure you give them a little bit at a time, let them master it, and then build another piece into it, let them master that piece, and then build another piece into it and let them master that piece. All while all these pieces that you've built in are moving them closer to their goal. And in this case is to get off metformin, which the large muscle group and large exercises using large muscle groups will take care of. She wants to join a paddling club, which means we know we have to strengthen her core and her upper body. So that is what I would do for this client. So based upon everything that we've covered up to this point, you should be comfortable putting together different exercise prescriptions or plans for these different scenarios. And this is where exercise physiology becomes very applied and very fun. So this is the end of this section.